Hello, welcome to Chapter 2, The Receptionist Team. We will go over phone skills and etiquette, how to turn a phone shopper into an appointment, discuss how to give medical advice over the phone, customer service practices, veterinary forms, and how to handle office finances. As we discussed in Chapter 1, the receptionist is the front line or face of the clinic. They provide the impression of the clinic as a whole. Some customers may be turned off of the clinic by one bad experience with the receptionist staff. Communication is critical for this position. You may need to explain hospital policies, procedures, prices, and listen to complaints and concerns of clients. If you do not know the answer, then you must find it. As the first thing a client sees when they walk into the clinic, the reception area must be clean and organized. Pets should be on leashes or in kennels to prevent clients or other pet patients from getting hurt. A receptionist must also know how to handle emergency situations and clients that might be making others uncomfortable. Communicating with veterinary technicians or veterinarians in the back of the clinic is critical to creating a smooth transition from the waiting room to the exam room and vice versa. Proper etiquette is needed in any professional situation. Receptionists should be respectful and empathetic. In veterinary medicine, we deal with death and serious illness. Providing a respectful experience during these stressful times is important to a client. Positive phrases should be used, and staff attitudes should not be negative. A clinic that allows gossip and cliques to form is not as cohesive, and a client will pick up on the lack of teamwork. Often clients can hear negative things coming from the staff and will decide not to continue to come to the clinic or refer their family or friends. Part of any veterinary team member's duties is talking on the phone. Take note of how loudly you are speaking, the tone of your voice, how fast you are speaking, and how clear you are communicating. If it is hard to understand you, a client may become irritated. One of the best ways to correct an issue in one of these 4 areas is to record yourself. When answering a phone, have a planned response. Also, be sure to have a pen and paper or computer page open to make notes recording the conversation. Some clinics have common questions and answers that a receptionist may use when talking to a client. Having this information readily available helps. Finding out what the client needs and then finding a solution to that is critical. Controlling the conversation by how you ask questions is important to reduce long conversations that take time away from clients inside your clinic. It may be okay to call the client back or ask close-ended yes or no questions to get the conversation moving. However, questions need to be asked to provide a better history for the veterinarian, so it's a double-edged sword. Managing multiple clients over the phone can be stressful. Be ready to have a few phrases in case it is busy in the waiting area and on the phone lines. If a conversation needs to be put on hold, a receptionist must have the ability to express this or communicate if they have to call the client back. Being on hold can also be annoying for clients, so try to limit it for a minute or less. Some on-hold messages can give information about your clinic. However, if listened on a loop, it can be annoying. If a call rings a 3rd time, another team member, sometimes the veterinarian, should pick up the phone. Call centers, or rather a place other than the waiting room, is a great way to have the best of both worlds. A veterinary or a few receptionists can handle potential or existing clients over the phone, while other receptionists take care of clients in the waiting room. This model helps retain customers, prevents mischarges, and provides information to new customers without having them leave a message or be put on hold. Think of a phone call as an appointment as a positive way to increase the services of your practice. If a receptionist is able to connect with the client, answer questions, and discuss what the client needs, then most calls will book into appointments. If a phone shopper is price checking the clinic, a receptionist can use that opportunity to explain what procedures are included in the price and why it matters for the health of the shopper's pet. When taking messages, receptionists must know when they should take a message versus when they have to get a veterinarian or technician involved in a phone call. Some callers may actually have an emergency situation happening and need to come into the clinic. When taking a message, ask what the message is concerning, who should receive the message, verify a phone number and caller ID, and then relay that message effectively to a team member. Some clinics have software programs that help disseminate messages to other staff members. Other times you have to write it down on a message pad. Always treat conversations with clients as part of the medical record. Be sure that there are not any grammatical errors or mistakes in spelling in the message. Messages must make sense and not be misunderstood by another reader. Information shared in a phone conversation needs to be recorded in the patient's record. This is helpful in case the issue is followed up by another team member or if the veterinary state board has to become involved. If something is not documented in writing, then legally speaking, it did not happen. Do not provide medical advice unless approved by the veterinarian. That veterinarian may become liable for any medical information given to a client that results in poor outcomes for their pet. When greeting a client, use their names and the pet's names. Wave or smile as soon as they come into the waiting room, even if you're helping another client or if you're on the phone. Friendly conversation is often important for both new and existing clients. Remember that we're in a service industry as well as a healthcare industry. Most veterinary practices have similar types of forms. New patient forms are provided the moment that a new client comes into the practice. Contact information as well as their vaccine history or previous medical issues should be included in these forms. Updating the client's contact information at every visit is also very important. All client conversations must be recorded in the patient's medical record. Rabies certificates are provided with every rabies vaccine and should be recorded with the state or provided with a health certificate. A health certificate is needed for interstate and international travel for any pet. Other forms are spay-neuter certificates. These are required when registering rabies tags. A medical record release form is to protect the contact information of the client. A client must sign a form to release their pet's medical records to a groomer, boarding facility, or another vet. Sometimes the form is signed with the new client form. If a client wants to pick up a copy of their pet's records, the records must first be completed by the veterinarian. Each state may have a specific process with this or timetable. Other important forms a receptionist must handle are release and consent forms. Any surgeries, euthanasias, vaccines, procedures, treatments, and boarding stays have to be signed off on by the client. If a client refuses a treatment or procedure, it is also good to get a client's signature. Consent forms are not required by law, but help the clinic provide information about the provided consent or informed consent that the client was receiving, and basically go over details and give handouts if the treatment is not elected. Unsatisfied clients are difficult, especially in a busy clinic. Try not to take the altercation personally, as you do not know what the client is going through. The client may need to be taken to another area of the clinic to provide privacy. Above all else, listen to what the client is saying and do not argue or cut them off. Repeat what you have heard and look for a solution. Sometimes the client may need to be communicated to after they are done venting. Reviewing invoices with clients is important to prohibit misunderstandings. If you simply just ask for payment without going over the items that the client received, they may get sticker shock and become angry. Not knowing what you are paying for is frustrating. Sometimes this type of interaction can make a client decide to go to another clinic. When taking a payment from a client, receptionists must follow their hospital's policies and procedures. If a transaction is cash, then the receptionist must make sure that it is not counterfeit. Some clinics only carry a small amount of cash and they keep the rest in a safe. Some practices take checks while others do not. When taking a check, you must make sure the check is signed, dated, and written for the correct amount. Cashiers and travelers' checks are usually less risky than personal checks. Most check readers' terminals require driver's licenses to be entered into the machine before accepting the transaction. Some clients choose to pay with debit cards or credit cards. Signatures on credit cards have to match the signatures on the slips, and we should also use picture ID to verify the name on the credit card. Care Credit is a care credit card, or a credit card that is exclusive for veterinary medicine. Clients usually apply online or over the phone in the practice. If any clients have declined transactions, it's important to not to react poorly. Ask them for another form of payment. Let the client know that their card was declined. Be sure that you follow all your procedures of your clinic for declined transaction or failure to pay. At the end of the day, a receptionist is required to reconcile all payments of cash, checks, and credit cards. If the totals don't match, when you are looking at the end of the day, you need to make sure that you look towards the cash drawer, because a lot of times that can be the issue with simple errors. At the beginning of the day, the set amount of cash is provided, so it should be the same amount every morning. At the end of the reconciliation, then you have your deposits. So basically, you want to get your deposits made on a daily basis because it's unsafe to leave large amounts of cash in the office. So all totals will match and should be double checked. Errors happen, so double checking a team member's work helps. The person checking the transactions as well as the team member should initial every transaction they look at. Petty cash should be used in times of emergency, like the example of the veterinarian needing turkey for a sick dog in the book. The exact amount of cash should be returned to the petty cash drawer every time. Overall, the receptionist is there to create that wow experience. So first impressions are important. We want to minimize the amount of chaos on the counter for the client, prepping medical records before a client arrives, and then looking for issues and plans if there is extended waiting periods. Schedule follow-up appointments right away, and if needed, again, this is a service industry, so help clients out to their car. Overall, the receptionist team is very important, so be professional and courteous. And that concludes Chapter 2's lecture.